Infectious disease experts say the darkest days of the coronavirus pandemic are just around the corner, fueled by Thanksgiving travel and gatherings. Hospitals like Rush University Medical Center in Chicago are preparing. Its lobby now transformed into a COVID triage area.
We will not get a reprieve because then Christmas comes and then New Year comes. So if we're just stacking surge upon surge upon surge, I am significantly worried about that.
Officials in San Antonio, Texas are concerned too. With cases rising, they issued a 10 p.m. curfew that lasts through the weekend, upsetting some bar and restaurant owners.
It is nonsense, and it's not fair to the citizens of San Antonio. They're grown adults. They can make their own decisions about whether they gather and how they gather.
Adam Abidia wishes people would take the virus more seriously. The Denver man was diagnosed with the virus in April. Doctors put him in a coma for a few months after both of his lungs collapsed. And today, he still needs supplemental oxygen.
I know it's a tough time for a lot of people. I've been through it. I understand it. I know what it's like.
Here on the front lines of the pandemic, hospitals, there is a glimmer of optimism. Frontline workers could get a first dose of an approved COVID-19 vaccine within a matter of weeks.
Pfizer expects the FDA will grant emergency use authorization for its vaccine soon. And last night, President Trump announced vaccine deliveries will begin next week. The Ochsner Health Medical Center in New Orleans participated in Pfizer's vaccine trial and is gearing up for distribution.
We are prioritizing our healthcare workers by the spring. Summer, we'll have more to give to those that are at risk, patients, and then eventually those that are otherwise healthy.
Moderna is expected to request emergency use authorization for its vaccine soon. A third vaccine candidate from AstraZeneca will likely undergo additional study after the company admitted a dosing error in the first trial.